impact. So our discussion, this is the third interaction that I'm having, and the very first with the hands-on experience. In the first session, we discussed on the need to do data analysis and to learn insights from all the data that you are collecting as part of your projects. In the second session, we just got introduced, and it was more interactive, where each of you have told your experiences on making tables, on making graphs, on making reports as part of your ongoing projects. So in this third discussion, I have collated data from everybody. I've tried to understand all your working requirements. And all of us are blessed with Microsoft Excel on our desktops, which comes along with us the moment we purchase our first laptop. So I felt, why not explore Excel and not only learn how to do it, but also understand what more can be done. So the title for the session is Data Visualization in Microsoft Excel 2016. Without any further delay, I'm going to go ahead with the session. Feel free to stop me at any point of time and ask your queries. I'll be very happy to discuss. Even if you feel we can have a discussion post this meeting on a later date, we have this habit of having one-on-one interactions to understand your individual level project requirements. So we will definitely take it up for discussion in the coming days, and we look forward to working with you. Now, before I start, Mohana ma'am, I've actually shared an Excel file. And maybe if you can upload it as a file on the chat, it will be nice. I have emailed it to you because I can share only Google Drive links. I can't upload files since I'm not an admin. So
Sure,
please.
I'll do that.
Thank you so much. So welcome to data visualization in Microsoft Excel 2016. That is me if my video was on. I have kept my video off so that there is no internet glitch related concerns throughout our discussion. I work at the Prasanna School of Public Health, Manipal Academy of Higher Education. And we move on to our discussion for today. So if you open Excel, no, if you quickly open Excel, you will actually find, sorry, the screen is a bit frozen. Sorry. Yes. If you open Excel and if you attempt to insert a chart with something typed in Microsoft Excel, you have a huge collection of options. You have column chart, you have line chart, you have pie chart, you have bar chart, you have area, you have XY, you have maps now where it is integrated to Microsoft Bing's maps. Okay. And there are some specific charts meant for data coming from stock markets, which we will definitely not cover. So there is a stock chart, there is a surface chart, and then there is radar, tree map, sunburst, histogram, funnel, waterfall, combo, box, and whisker. So most of us in our entire lifetime, okay, most of us stop here. Some of us choose this, especially when we collect data across months or weeks or years. Okay. Some of us reach here. And almost all of us stop here. Okay. If you ask me what are the popular charts, these are the 4 popular charts. Okay. But if you look at it, Microsoft Excel has a lot to offer. So I thought, why can't we just start doing something about it so that you learn about the opportunities that you have to present your findings and impress your audience and help them understand what is it that is happening in the background or your field of work. So broadly, a broad classification of charts they are put into 4 categories. One is relationship category. Okay. Whenever you want to see relationship between variables. I hope you remember the discussion which we had on variables, where we said each of the columns in Excel sheet that you are going to collect will represent a variable. It could be adherence rate, people lost to follow up, people enrolled for screening. All these are variables. Okay. Gender, age group, all of these are going to be variables. So if we are looking for relationship between variables, we go for a series of charts called scatter and bubble. If we want to compare, if there is comparison, like we want to do comparison across males and females, we want to compare adherence to treatment between a location, district, one district in Uttar Pradesh and another district. So if our goal is to compare, then we use bar charts. Okay. We also use radar chart, which we are going to learn today. We also use line chart to compare across time. Okay. So these are the charts which we use to do comparisons. Okay. Now, if our goal is to understand, okay, I'll give you a scenario. If our goal is to understand, the gender contributions. So you are screening for TB in a particular city and you found that 1,200 people appeared for screening, of which 800 were male and 400 were female. What are you doing? You are actually finding the share of total, correct? Part of the whole, as we will tell. Part of the whole or share of the total. If you are trying to understand the composition, how many are highly educated? How many are illiterate? How many have undergone schooling? If you want to visualize all of that, we make use of composition, which may include area chart, stack chart, waterfall is something we are going to learn today, and then the pie chart. Now, if your goal is to compare distribution, for example, I want to see the age distribution of people who have adhered to a particular kind of treatment. Suppose I want to know that I have a series of charts called histogram, box plot, scatter chart, to mention a few. So these are the four broad types of charts we are going to see today. Okay, that is what we are going to see today. So we will take the list one by one. Okay, we will go one by one in the same order. So first we will discuss column chart. I have shared a data which is also shared on the chat. Okay, I want you to download the sheet so that you can do it along with me. Okay, so we will go in the same order. And we will not cover stock chart and surface chart because it is meant for handling financial data, particularly data coming from stock markets. Okay. So except these two, we will cover all the charts which are available in Excel so that you get a practice of it today and we can have a follow-up discussion in the coming days to identify which is most suitable to the problem that you are facing in your project. So moving on, I hope all of you have checked chat and all of you are downloading the file. It is there in the chat. Please click it up so that you can download the sheet and have the same screen as I do. Okay. Now, the first chart we are going to cover today is the column chart. It is the column chart. Okay. In simple terms, column chart is a bar chart that is standing. Okay. How many of you are familiar with bar chart? Can you give me a hand raise or, can you tell me about it? Bar chart. Are you familiar? Because I see a new faces, a few of them. That is why. Chandan says yes. Anybody else like Chandan? Anyone? Okay. So, column chart is actually bar chart that stands and bar chart actually sleeps. You see, this is column chart. This is bar only. It is standing. Okay. Now, if you put bar chart to sleep, it is actually called bar chart. Okay. So, we will start off with column chart to begin with. Okay. So, the purpose of column chart is to compare values across categories. For example, I want to compare monthly TB case counts, okay, per clinic. And I have 10 clinics. Okay. So, I will have 10 bars. Okay. It is used when you want to compare count, which means the variable here is a number. Okay, number of cases, number of people adhering to it. Okay, or across groups or time points. Okay, that is when you use a column chart. Each bar's height represents the numerical value. So if you look at the chart here, in Lucknow Central, there is approximately 120 TB cases by clinic in Lucknow Central. So the height of the bar is what is important to us. The taller the bar, in this case, more is the number of cases. Okay. So here I have covered clinics in 4 different areas in Uttar Pradesh. So in the x-axis, I have the location of the clinics. Okay. And in the y-axis, I will have the number of TB cases. If you notice, the bar chart always begins from 0. And there is equal space between the bars. Our interest is looking into the height of the bar. So if I look at it, Kanpur city has the most monthly TB cases by clinic in Uttar Pradesh when compared to Lucknow Central, Agra North, and Varanasi East. That is what I learned. Okay. Now what I have done is, in order to tell you how to enter data, is my Excel sheet visible to all of you? My Excel sheet is visible?
Yes.
Yes, ma'am.
Thank you. So let us take the very first sheet. So you see, in the very first row, I have put the name of the column. Don't write column names in any other cell. First row is dedicated to column names. Okay. And enter your data column wise. Now, if you select all, just select all. Okay. I hope you are seeing what I'm doing. Just select all and then click on insert and first click on recommended charts. Okay. You have two options. You can either click on recommended charts or you can see all charts. If you are very clear of what kind of chart you want, you can do that also. Okay. So most of the time, thanks to AI in Microsoft Excel, there is a mechanism where based on the data you have entered, Excel recommends the best chart. But remember, it is not always correct. Okay. Remember, it is not always correct. But in this case, it is correct. That is why I clicked on it. So we can select all charts. Okay. And you see that there are many options. See, there are many options for you. Okay. First and foremost, I would like to tell you that please avoid 3D charts. Please avoid 3D charts. So we will select the recommended chart by Excel and we will click on, it's already selected. If you want this, you can select this also. And you can click on OK. Boom, your first chart is ready. Okay, your very first chart is ready. Now, there are many options for you to explore. Remember, I told you don't do 3D charts. So what I'm going to show you a couple of things. First of all, I want you to see what I'm doing. I'm changing this 90 to 155. Okay. The moment I change the data, the Excel sheet also automatically changes. Now what I'm going to do is, like you guys, I also want a 3D chart. So I'm going to look for options and get my 3D chart. So I'm selecting change chart type. You will see it only if you click here. If you click on chart design, this is very, very important. You will have many options. You can play with colors. Okay. You have many options to beautify it and make it very legible. Okay. You can also change chart type. Now let us go 3D. Okay. Let us go 3D. Okay. Now I'm going 3D and I am removing I will try to remove the numbers and I will tell you why. Okay. If you remove the numbers, how much ever you zoom, you will never know that this is 150 and this is 155. Because of the 3D effect, everything will appear to look taller. That makes your interpretations very, very difficult. Because of the 3D effect, everything will be taller than the actual height. That will complicate an understanding to anybody who is not part of your team. Suppose you are presenting it to officers who are sitting in the district health office. Okay. They will not know your work as much as you know. So they'll be like, no, ye to same hai. There is no difference. Kanpur and Agra, both are equally bad. More cases are there. But actually, Agra had 5 more cases in a month than Kanpur. So you will miss out on the important parts when you choose 3D. And never ever have bar charts hugging each other. Okay. The rule for bar chart is there should be equal space between the bars. Okay. These are things that you should be very, very cautious about. Okay. And always choose colors in a manner that they are friendly to colorblind people. I repeat. Okay. Because it's a very, very important thing. You have to always develop inclusive charts where people with any forms of visual challenges are also taken care of when you develop a chart. Okay. I hope you could do it for your study. Okay. You can change the layouts. You can ensure that original data is depicted. See, this is one of my favorite options. You go to quick layout, click on this option. It will come as date. It will come as actually bar chart with the data. See, very clear, crystal clear, very nice. Now, if I have to emphasize on one particular thing, suppose I want to emphasize on the fact that Agra has the highest. I can actually select only one. That is also possible and then change the fill. See, only that is changed. I can highlight, I can emphasize when I have my bar chart done on Excel. I can also change the axis titles. Okay. I hope you usually do all these things, but I'm still telling you. So I'm putting it as number of monthly TB cases. And this is bar chart of monthly TB cases in UP. We can also have the data labels inside or outside. I chose this because it gives me a sense of clarity. This is a brief idea about bar charts available in Microsoft Excel. Okay. Can I go ahead? Can I go ahead with my next super chart? If there are no questions, I will go ahead. Yes. The next chart that we are going to learn today, thank you, Bhaskari. The next chart we are going to go ahead today is line chart. Just like how the name is, there is a line in the chart. Okay. So majorly, most important thing is you use line chart to show changes over time. Okay. You use line chart to show changes over time. Okay. So x-axis is usually time. It could be weeks, it could be months, it could be years. Okay. So to visualize trends, that is the technical term we use. Trends or patterns over time, we make use of line chart. It is important in the context of tracking, which is very, very important work that you do. For example, are you tracking monthly referrals or weekly medication adherence or patient visits over a period of time in a clinic? And do you want to compare it across clinics or across districts? Then line chart is your option. We have a sample data here where I have chosen weekly TB referrals gathered over a period of 2 months in a particular location in Bihar. Let us assume. So, line chart, how do you start off? You first look at the number of cases in week 1. It is 25. Number of cases in week 2. It is 30. Number in week 3. 27-ish. 35. So you mark all these points and join all the dots with straight lines. Okay. So if you are seeing an increase, there is a rise. If you are seeing a dip, then there is a dip in the line. Okay. So if I look at this graph, I feel that initially there was a concern. Referrals were very low. However, it gained stability by week 4. So maybe you are giving an intervention to improve referrals. So you are observing over week, you gave a referral a training here, and after that you are seeing steady increase in the number of referrals. Okay. The raw data for this particular chart, I have put it in the sheet 2, which I am going to book. I hope my Excel sheet is visible. If ever you encounter any screen problem, please unmute and tell me immediately. Okay. So here also it is important that if you don't have your your variable names properly done, the chart will look bad. Okay. If you do it properly with very, very less amount of work, you will get your chart done. You can also replace it this way, like, Jan fortnight 1, Jan fortnight 2, Feb, I'm just saying, or Jan week 1, sorry. It was week 1, no? Jan week 1, Jan week 2, Jan week 3. So you have to enter your data in a nice fashion so that you can do analysis. Okay. Feb week 1, Feb week 2, Feb week 3, Feb week 4. So now if you select this and then go to insert and then we can always choose recommended charts so that you can have a look at it. Okay. So you see how dirty the pie chart is. Nobody understands anything. It's clear-cut indication that it is not correct. The first option is bar chart. Bar is an alternative to line chart wherever you can think of it. Okay. So here I'm going to choose line chart. Okay. Alternatively, you can go and choose line chart here and see all the varieties. If you go to recommended charts, you will not get varieties. You will just get the basic chart. If you go here, you will get with the varieties. And I always want it to be having markers. Okay, I want it to have markers. So I'm going to click on, and you get a preview here. So don't click on OK and run away. See how the preview looks. See different options. This is very, very confusing. Nobody understands. As usual, it's 3D. Okay. See the different options you have. So you sometimes, some differences you will see only when you have, let's say this is clinic 1. Suppose you are having clinic 2, then maybe you will be able to see the differences between the options. So here I am choosing this. Okay. And I can also add elements. I can add data labels in the center or in the left or in the right or above or below, or I can have a data code, which is very, very confusing. Okay. So I usually choose below, okay, or above, because it gives me a sense of clarity. Okay. Center is very confusing. You will not see anything. Okay. So I usually choose below or above. So now I can see the patterns. Very, very clear. Very pretty. You can also look into many options. Don't go this and all. Don't choose all this. Please have your white, preferably with margins. At least simple margins to begin with. Can have minor shading and all and make it look pretty. Don't go double line. Very confusing. Nobody understands anything. Shadow also does not help. It hides the actual value. This is another alternative that is commonly used now. Okay. Yes. Okay. Now, you can also change the layout. You can have data inside it. You can also have legends marked properly. Okay. There are many options. See, I personally prefer this, if not what I am showing it to you on screen. Now, whatever you give here is the name of the chart. So if you make it line chart of TB referrals, it changes. See, it is important that you name things properly before you come up with a chart. Okay, so that was line chart for us. Now, moving on to the third chart, which is the pie chart. Okay. Pie chart is actually used to represent a category's share of the total. Categories share of the total. That is where you use pie chart. What percent of the total is females? What percent of the total is males? What percent of the total is highly, high salaried people or urban class? Okay. So you want to know share of the total. And the size of each slice of the pie chart represents the proportion. Please use it only if you have ideally less than or equal to 5 categories. Okay. 5 to 7 itself is a big confusion, but definitely not more than 7. For example, percentage of TB cases diagnosed by different methods. Okay. In one health facility. Okay. So here you have 10.7% TB cases diagnosed by culture approach, 17.9% diagnosis by chest X-ray, 42.9% by gene expert methodology, and 28.6% by microscope. Always remember that the percentages have to add up to 1. Percentages have to add up to 1 or 100%. Okay. Here, is it adding to 100%? Can someone unmute, check and tell me? Can someone check and tell me? Anybody? Is there any problem with the pie chart? Anyone, anyone? Okay. Please add 10.7, 17.9, 42.9 and see what is happening. There are two problems. Trust me. Problem number 1. If you add it up, it comes up to 100.1. Somewhere rounding error has happened. And problem number 2, it is definitely not colorblind friendly. Okay. These 3 colors will look the same for someone who is colorblind. Okay. And never ever use bright colors. Okay. So now we move on to seeing the findings in Excel. Okay. So here what I have done is, I have used raw data. I didn't compute percentages and keep. I gave the raw data. Okay. Now let me select this and attempt a pie chart. Let us see what happens. Okay. Here also it recommends a bar chart. Most of the time Excel will recommend bar chart over pie chart because our human nature is to, we tend to understand heights and widths more than, or things inside square or rectangle better than circular shape. That is the way our eyes are designed, which Microsoft Excel is very much aware. So it will always recommend bar chart over pie chart. Both are actually correct here. Okay. So moving on to pie chart. Let us see. Okay. Let us see. See, Excel itself is telling, do not use this chart if it contains many slices, as angles become difficult to estimate. And it will be very difficult to visually understand also. So click. We get a pie. Now, as usual, we change the layout. We play around with the data. We do a quick layout. We try to get it in percentages. Okay. The numbers are not very visible. We are not very happy. So we will click on options and see how I can modify the data labels. Okay. I can format data labels. I can show it as percentage. See, I can decide where the position is. I can keep it in the outside end. See, outside end is actually very nice. Inside end is very confusing, especially with dark colors. You can keep it in the center. You can keep it in the best fit. You can again, I prefer outside because it becomes very, very easy for everybody to understand. Okay. You can give legend key. Okay. Where colors are also taught. So you got a blue dot, no? You can also show the value. Okay. There are many, many options. How can you separate? You can create a new line separation. Many options are there in Excel for you to play around with. You can also, earlier you used to be able to manually move. Now it's possible, but slightly difficult and you tend to get lines, okay, which I avoid. Okay. Yeah. So this is the example for a pie chart. Here it is very clear that nearly 43% of people got their TB diagnosed with the help of Gene Expert technology. Okay. And minimum, very few people, only 11% focused on culture, 18% on chest X-ray, and remaining 28% on microscopy. So I gave raw data, Excel computed percentage on its own. Okay. And now let us add and see if it will come to 100. Okay. So I am adding, I hope you are with me, 43 plus 28 plus 11 plus 18. See, Excel automatically checks whether it adds up to 100 by default and does the appropriate rounding very correctly. Okay. I hope there are no questions. So we move on to the bar chart. This is very similar to the column chart. Only thing is here, the bars are sleeping. Okay, here the bars are sleeping instead of standing up. So X becomes Y-axis, Y becomes X-axis. There are no specific changes apart from that. Okay. So just for your understanding, so that you understand what is bar and what is the difference between bar and column. In bar chart, the bars are horizontal. In column chart, the bars are vertical. Both convey the same idea. Bar chart is especially useful if you are aiming for publication because it takes up less space in your page. In your entire report, it will take up less space than a column chart. That's the only benefit you have. And we always read from left to right, no? So you can continue reading in that fashion rather than looking up or looking down. Okay. Now, moving on to area charts. Okay. I hope the ideas are clear so far. I see some things in the chat. Okay. Exactly. Thank you, Akshi, Bhaskari, TBPPM team, and Akhande, if I'm not wrong. Yes. So now I'll move on to area chart. Area chart is made popular by Excel only. Okay. In the very older versions of Excel, area chart was not there. But now it's a new addition. Especially with 2016 version of Excel, area chart has multiple features also, which we can explore together right now. Okay. So moving on to area chart. So it is actually like a line chart. Only thing is area under the line is colored. See, it is exactly like a line chart. So when it is colored, no, it's like I'm sure all of you use Instagram. So when it comes to women, when we wear sari, okay, we have certain kind of jewelry that will add value to the sari. Now, if it comes to men, the accessories that you carry along with your shirt, it could be the color of your tie. It has a huge impact on the way you appear with the shirt and the tie. A wrong color choice of the tie can ruin the beauty of the shirt itself. So just like how we play around with your costumes, Excel played around with line chart to give you area chart. So the idea is if you color, you tend to see the increase and decrease with more clarity and comparisons become more easy. So wherever you can use line chart, you can use area chart also. See, x-axis is again time and y-axis is again count. Okay, we'll quickly go to Excel and see what Excel has to tell us. Okay. Bar chart data I have just placed for your reference. We move on to area chart. Quickly select, click on insert, go to recommended charts. You found area as number 4. But actually area is an equivalent of line chart here. You can choose either line chart or you can go for area chart. 3D area is also there. Please don't get carried away. You will not get clarity and your understanding will be heavily affected. Okay. Choose a simple area chart to understand your data and be very careful with your color choices. You can go for dotted lines, slightly dim colors. Okay. So it looks very visually appealing. Here also you can play around with the layout. You can also add data labels, right click and just say add data labels. Several options will come. You can choose the right option. Okay. See here labels have come inside. You can bring it all up if you want to. You can also bring them up one by one. Only thing is if you manually bring up, lines will come. So I request you to exercise caution. This is a smart way to do it. No worries. Okay. Now, moving on to the next chart. That is the scatter plot. Okay. The scatter plot. One of the most beautiful plots which you have been learning from your school or college days. You will also find it repeatedly coming up in newspapers. So you have two numeric variables. For example, number of follow-up visits versus treatment success rate. So here both are numbers. It's not something like gender, male, female. It's actually numbers, counts. So if you want to see whether there is any relationship between number of follow-up visits versus overall treatment success rate, okay, you have to plot the scatter plots. So in this diagram, we have in the x-axis, we have number of follow-ups, average number of follow-ups by patients to the Agra North TB clinic, and the treatment success rate, which stands at 80%. So here you see a straight line package, meaning as number of follow-ups increases, treatment success rate also increases. But don't go blindly by this line and tell there's a huge jump. It is not true. It is here, the axis is between 80 and 92 only. Okay. So be careful when you interpret. Now I have the data for this in Microsoft Excel, and we are going to see it together. So here we will select all, and we will click on insert, choose recommended charts first. Unfortunately, it did not give us scatter plot as an option, but it definitely keeps scatter plot as option number 3. So it's one of the priorities, because you can also go for a subdivided bar chart. This is a subdivided or a stacked bar chart where for number of follow-up visits and success rates are mapped together. But I always suggest that you go and choose scatter plot. Okay, go and choose scatter plot. There are different kinds of scatter plots. This is a wrong thing which Excel is doing. It's actually a dot plot. Cannot be called a scatter plot. So never choose the first option. Choose the second option. Okay. Choose the second option. Or else if you don't want the line to appear, just choose the second option here. Okay. If you have one more variable, we could have chosen the bubble chart. We cannot do it because we don't have a third variable. If you have a third variable, you can choose bubble chart. Again, don't go 3D, please. Okay. So I'm choosing a very simple chart, and I will definitely make some small changes. Okay. Maybe change the layout a bit. Add that line to indicate the linear relationship in the success rate. Okay. And preferably add the equation surrounding the line. Okay. There is always a regression line. There is always an equation. It is very, very relevant for in your reports that you show this equation as well. And I will present my findings. So in the x-axis, I have, what do I have? In the x-axis, I have follow-up visits. In the y-axis, I have success rate. And this is a scatter plot of, so scatter plot, colon, relationship between follow-up visits and success. In this case, this can be removed because it is very clear, so that you can have a better, nice line. Okay. This is how you present findings from a scatter plot. Okay. Now, I'm just saving my file. I hope you are able to do it and also see the change. Any questions so far? Okay. How about others? Are all of you there? Okay. I just kept small data sets so that you can understand the chart and you can play around with the numbers, with the contents here, and you will be able to see the differences. It will help you make your plots look more visually appealing, rich, and more content into your graphs. Okay. Moving on. There is an interesting thing called map charts. Have you ever tried map charts in Excel? Have you ever tried map charts? That this map is created in Excel. Trust me. Mm. So this is again a very new feature that has come from Excel 2016 onwards. This is a chart. I did not use any software. I did not use any online tool. I just used Microsoft Excel. And it required me to connect to internet so that I get the updated maps. Okay. If you look at it, here Andhra Pradesh, Telangana is clearly differentiated. Pretty good. And I literally counted all the states. It made sense to me. Okay. So I'm going to show you how to construct a map chart. I'm trying to go to Excel sheet. It might take a little while. We will cover map chart as well as a radar chart before we wind up for the day. Okay. Map, I felt it's very important and relevant because you might require it. Probably district-wise maps might be very helpful for you. So in this study, what I have done is, so what the instructions given by Microsoft Excel is, use the correct name of the state if you are choosing data from a country. Okay. So don't choose old names. Okay. For example, don't call Maharashtra Bombay or, Tamil Nadu as TN, West Bengal as WB and so on. Use the name that is accepted by the respective state governments and the country at large. So here I first entered this data randomly. Okay. I just entered this data randomly like the way you did. Okay. I just entered the data randomly the same way as you did. I just formatted it for beautification, but nothing else. And then I selected it. I clicked on insert. I went to recommended charts. And I found this option. I was so happy. So if you don't find that option, what you should do is select all charts, go to map, okay? Go to map and click on OK. Okay. Now, this may not work for you in my style. So I will remove my chart. Okay. Because I have already done once now. Yeah. Let us add Kerala also. Okay. Okay. Now I select. I click on insert. I click on maps. I click on maps. You will get the Indian globe first. That is highly possible. You will get the Indian globe first. Didn't you? Please try. Please try. Please try this with me. And are you getting what I'm getting? So if you double click on the chart, there are many options. You can choose the different map projection options. Okay. There is a Miller approach. There is a Mercator approach. Both of these are very suitable for us. Now, map area, okay, if you choose the world, you will get world and then inside that you will get India. Okay. If you choose only regions with data, you will get parts of India where data is there. If you choose only country region, you will get the correct map. Okay. And if you choose multiple regions and countries, you will definitely get Asia, including the Gulf. Okay. If you choose world, you will again get the world. So in this case, country region is the most appropriate thing. You can give labels if you want, but the problem is it will not be clear because the map is too small. So you will have to make the graph very big. Okay. The graph will have to be very, very big in order to have all our state names properly written. See, you can make the graph bigger and bigger in order to get all the names. Okay. Be really big. Now only it's coming. See. So map chart, the problem is the names, if you want, it has to be really big. Now you can select it. I'm going to do Control C and Control V. Let's see. Control C. Copied. I pasted it here. I will paste it again. And I will paste as an image. So I will get the entire thing with the name. Okay. This was just to show you how it can be done. It goes well. It makes your reports beautiful and pretty. Okay. I tried one more for all of your reference. What's happening? Okay. With the block. Yeah. It will not work. You have to choose the correct option, Navneet. So try different options and find if it suits you. Now I will show you one thing which I did for Bihar. Okay. It will work for up to district level. Okay. So this is the one which I used to create for Bihar. Okay. Now I will double click and show you the options I chose. Okay. So this is the one I did for Bihar. Let me select data one more time. So by default, it will give this. Okay. But the problem is you can't find, it is actually colored. There is Bihar region which is colored. But you cannot find it because Bihar is too small, no, compared to the whole world, right? So let us see. So choose series options and then you tell Mercator or Miller so that it appears very clearer. And then map area, you can either do state or province. Sometimes it does not work for countries like India. So I went and chose, first I chose country and region. See, then I get to understand. Okay. And then I did only regions with data. And then I made it add labels. Okay. And then I zoomed in the image. Okay. So this country province setting is not the state province setting is not working well for India. If it was US, it was all nice and clear. And as rightly mentioned by someone, block level data, we are unable to map it as of today. Okay. But this is something I'm going to keep trying. And if I find a shortcut, I'll share with you. This is very interesting to see. I like the way the colors work. You can change colors. There are a lot more options, just like any other chart design. So you can have a nice color palette you can have, okay, depending on your requirement. Okay. Now the last chart of the day is, I hope this was fun, isn't it? Let me see where you are. Font size. Okay. Good question. 1 minute, 1 minute. There was an option where you could play around with the text. 1 minute, 1 minute. Oh yeah, that option is not there for this, okay? Because for all other charts, you can actually play around with the font size. You just need to select and you could do. Okay. But for maps, it is not possible because maps are done. No. Let me see if this option. Nope. Let me also try what will happen if I reduce the font size here. Oh, only chart title is changing. Sorry. Not affected much, okay, by the font size. No. That's a question. I'll take it. If I find answer, I'm going to share it with you. Yeah, I understood. The only way is to make the chart look very huge and then go and save it as an image in Word or PowerPoint. This is actually a very new feature, Akshi. So I was very happy that we finally got it because I used to use some online tools to get this chart. So now at least I need not share my data online, right? So yeah. Moving on to the last chart of the day, we have radar chart. We have radar chart, which is actually, I'll go ahead with the explanation to begin with, and then I'll come back with how to do it in the format for the kind of data that we deal with. So you see this chart, okay? So here we have 3 variables: tests completed, referrals, and then treatment started across 5 centers. Okay. So the blue color corresponds to Prayagraj and the red one corresponds to Agra North. So from here, what I understand is Prayagraj is performing really well in terms of treatment started, tests completed, as well as success rate. But it is performing relatively low when compared to Kanpur in the context of reference. So I have 3 variables being assessed, and radar chart will help me geographically compare regions across multiple characteristics or variables. In this case, we have 3 variables. In this case, we have 3 variables. So I will show you the data. Let us construct a radar. Let's first see if Excel will recommend such a chart. Okay. Excel will not recommend complicated charts. You should always remember. So some things we will have to learn on our own. So choosing radar. Okay. There are different kinds of radar. Okay. So you are getting 2 different kinds. One where you are having 5 different regions and variables are colored inside. And the second radar is, so you get 2. I'm going to show you both. Okay. This is one. Sorry. This is one. Okay. Now we'll do the other. This is another one. So this will compare here. Regions are our heroes. Okay. 5 regions. But problem is when you have more and more regions, this will become a very complex spider web. So it's good to reduce it, which is why people recommend this over this, because here you are able to look at all variables and then you can compare the 5 regions across each of the variables. So as I rightly pointed out, I can understand that Prayagraj is doing really well. Okay, except for referrals. Now, what is happening to Kanpur? Doing exceptionally good in referrals, but treatment started is less than Prayagraj. Test completed even lesser. Okay. So that is what I learned by looking at each of the charts. So if you are assessing performance of different centers across 3 or 4 variables or 4 aspects, in this case, it is treatment started, test completed, success rate, referrals, you make use of radar chart. I hope this is a new chart too. I hope this is a new chart for you too. So these are some things that I wanted to cover today. I wanted to have the session into 2 parts so that you also get ample time. But when it comes to the analysis part, I have shared the entire list that I intend to teach you. But I thought let us not do everything in one shot in one day, because it will be too much to do for a day. And more than that, too much to learn as well. Okay. So I'm open to questions from you. And I want you to explore the charts which we have covered today so that you can apply it, experiment it, and then we come back for further discussions. Okay. So that we come back for further discussions. I am open for questions that you may have. We can also have a follow-up discussion in the coming days and catch up over another meeting to completely and comprehensively cover Excel for data visualization. Okay. So over to you guys.
Thank you. Thank you so much, Dr. Vani. The session is open for discussion. Sure, sure. I'll share the recording in the group with all the emails. Thank you so much. Please, you can ask the questions directly to Dr. Vani now.
Hi, yeah, am I audible? Hello.
Hi. Hi.
Yes,
Yeah.
Navneet.
So thank you for the session. It was really good. I just have a one query which I mentioned in comment section also. Actually, we are working on panchayat and block level, and if we want to show our panchayat wise and block wise data or some information in only in one district or district wise, like in district block wise or panchayat wise data we want to show in map chart. So is there any other option which we can opt to show that kind of data?
Yes. So in Excel, the options when it comes to a country like India is very limited because it basically pulls out data from publicly available sources. So if you look at it, even finding an Indian map with blocks and taluks is a huge challenge, isn't it? So it may be a slightly challenging task, but I am going to explore AI tools for it. And definitely, if I'm getting a comprehensive solution for it, I'm going to come up with it. Meanwhile, how you can help me is you can maybe send me, maybe one state with not data, but just the taluk or block names. If you can share that, then I can put some numbers and experiment. And if I get a solution, I can definitely share the findings. Just give me the names. Don't give me data. Just the name of the state and the blocks taluks. Okay.
Sure.
Hi, this is Chandan here with Navneet. I just have one follow-up thing regarding the same question.
Yes.
Should we have to layer it up with the GIS also? Like we need to plot.
I am actually trying to avoid GIS related applications because what is happening is again getting the shape files for India is not easy. I hope you also would have experienced
That's
it.
true. Yes, ma'am.
So
Yeah,
I
yeah.
would prefer some AI based tools for a solution compared to any software downloads because that will just make your system more slow, to be very honest. And we already have lots of data in our files. So I will try for a very friendly way. I will take this question very seriously, but just share one state with the taluk or block name that you are looking for.
Sure, ma'am. Yeah, we will share it to you, and
Need not share any
I do have
numbers.
mail
I
ID.
will I will put some
Sure,
fictitious
sure,
numbers and go ahead. Okay.
sure, ma'am. Sure. We'll share it to you, ma'am.
Yes. And yes, radar chart I will discuss with more examples. If you have any use cases, you can also talk so that I can be more aligned to you. Yeah. These are the questions I see on the chat. I wanted to introduce so that before our next session, you will at least play around with some data and have more project specific questions so that we can have a more engaging discussion.
Thank you all the participants for your active participation on today's Module 3 Data Management Training and Mentoring Program. It was truly encouraging to see such enthusiastic engagement.